the lungs transfer oxygen from the air to your blood. They also take carbon dioxide from your blood and get rid of it when you exhale. Lung cancer is a disease caused by the unchecked growth and spread of some cells from the lungs. Non-small cell lung cancer is one of two major types of lung cancer. The other one is a small cell lung cancer. The most common subtypes of non-small cell lung cancer are adenocarcinoma, squamous cell epidermoid carcinoma, and large cell undifferentiated carcinoma. Non-small cell lung cancer is the most common type of lung cancer and affects about 8 of every 10 people with lung cancer. There is no single cause of non-small cell lung cancer. Like most other adult cancers, non-small cell lung cancer is caused by a buildup of damage to cells. Over many years, this damage changes some cells so that they can grow, multiply, and spread unchecked. If a cancer isn't completely killed or removed, it can spread to other organs. A cancer that is spread to another site is called a metastasis. There are two types of risk factors for non-small cell lung cancer: risk factors that you can change and risk factors that you can't change. Risk factors that you can change are smoking, being exposed to secondhand smoke, radon like in a basement, asbestos by working in mines, mills, textile plants, or with old insulation, uranium and other radioactive materials, chemicals like arsenic, coal products, and diesel fumes, and arsenic in drinking water. Risk factors that you can't change are air pollution, having had lung cancer, prior radiation therapy to the lungs, and parents or siblings with lung cancer, especially if young when diagnosed. The symptoms of non-small cell lung cancer are not specific. Possible symptoms are a cough that doesn't go away or gets worse, coughing up blood, rust-colored spit, hoarse voice, unexpected weight loss and loss of appetite, shortness of breath, feeling tired or weak, a lung infection such as bronchitis or pneumonia that won't go away, and wheezing with no known cause like asthma. Symptoms that non-small cell lung cancer has spread to other organs are pain in the back or hips if it's in those bones, headaches, weak or numb arm or leg, dizziness, balance problems, and seizures if it's in the brain or spinal cord. So far, researchers haven't found any drugs, vitamins, herbal remedies, or alternative medicines that can help prevent lung cancer. The most important thing you can do to lower the risk of non-small cell lung cancer is don't smoke cigarettes, cigars, pipes. Other things you can do: avoid secondhand smoke, avoid radon and other chemicals that can cause cancer, eat a healthy diet. Having a small cancer that hasn't spread outside the lung increases survival. The 5 basic ways to treat people with non-small cell lung cancer are surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Which options are best for you will depend on factors like your tumor type, size, location, and spread, tumor molecular
Good morning, ladies and gentlemen. Good morning to the program Platform for Education. This is the program Platform for Education. We are here this morning again. We have been, today is the 25th day of November. Okay? And your host, Your host is Demons Kakula Pay. We have been discussing for this week, we started last week, we have been discussing venereal diseases. We talk about the bacteria, we talk about virus, and today we are talking about parasites. We are talking about parasites. How parasite is divided into two sections, just as bacteria is divided into two sections. Bacteria, we got gram-negative bacteria, we got gram-positive bacteria, and those are bacteria that we know their character, what they do. In that way, when you come to the hospital and something go wrong with you and we discover the sign and symptom, it will put us into a particular area to determine whether this is gram-negative bacterial infection or this is gram-positive bacterial infection. Then it leads us with giving you the right type of medication. Okay, so that's what we're going to do. That's what we've been doing. So today we're talking about parasite. This is Platform for Education. We are broadcasting live from the state of Pennsylvania, United States of America. Please share the video with other people so that we can know that you are around and you are getting the message. All right. This network is Liberian Radio and Television Network. Okay, it's for everyone, everybody in Philadelphia or beyond. You want us to do anything for you, we can carry you live on birthday party, wedding party, any little group that you want us to put you on, we can do that. All you need to do is to call us. We will take care of that. Okay? All right. We will start with parasite in a few minutes. For right now, I'd like to take a little break and we'll be right back with you.
Why must spoil you for? Why must spoil you for? Why must spoil you for? Then activate it. Some kind of way I can get it. Why must spoil you for? Some kind of way you can do it for me. Why must spoil you for? Yeah, some people go sleep and I wake up. I go sleep, I wake up, oh, eh. People hustle, no day, no day. But my hustle bring it so much in. Oh, I must spoil you for. Why must spoil you for? Why must spoil you for? See, I pay your blessing that no more thing. Tell it before you can do it again. All kind of thing can creep my skin. When you get my own, I go cock in my leg, oh no. Cock like a big boy. Jehovah, you make me a big boy. When they make it noise, I don't talk. Take a lepe, walking one side. The students say they bluff it, and they come in, they be great boy. Blessings on blessings on blessings. Jehovah, you shower your blessings. Thank the Lord, Jawana. No, some kind of way I can get it. I must spoil you for. You can do it for me. I must spoil you for. Yeah. Some people go sleep and I wake up. Then I wake up. I go sleep, I wake up. I wake up. Yeah. People hustle, no day, no day. something. I was spoiled. I travel too far, I come back. Go America, I come back. I go Australia, I go Norway, I go Sweden, come back. Begin let me go Holland, begin let me go Germany, begin let me go Britain. I keep bagging on me, let me for MTV. I be represent on MTV. Mama see me on MTV. Why am I spoiled for? Some kind of way I can get it. Live boy, I'm a spoiled for. Some kind of way you can do it for me. Papa, I'm a spoiled over. Oh, some people go sleep and I wake up. Then I wake up, then I wake up. I go sleep, I wake up, I wake up, I wake up. Oh, hustle, no day, no day. Then I get it. But my hustle bringing so much in. My hustle, I'm inspired. I'm inspired. I'm inspired. The DJ they liking and playing the music. That's cool, I shine for me the music. You over keep blessing the music. The facts, let them talk. But you over bless you, who can go for? Mama spoiled you, Mama spoiled you, live high. Oh, Mama spoiled.
These are 5 facts about breast cancer in under a minute. Every 13 minutes, a woman in the USA dies of breast cancer. 1 in 12 women will be diagnosed with breast cancer in their lifetime. Breast cancer also affects men and kills 450 men in the USA every year. Exercise such as walking and a little light jog will reduce breast cancer by 30%. Breast cancer is one of the most survivable types of cancer.
Good morning, we are back. We are back. Good morning, we are back. Like I said, welcome to the program Platform for Education. This morning, we are discussing our segment, venereal diseases. Okay? Venereal diseases.
Okay.
Yeah. Yeah.
You on?
Yeah.
Oh, yeah, but I see you playing commercial one.
No. I was playing commercial, yeah.
But you back on that, right?
Yeah.
Okay.
So, our segment we've been discussing this week is venereal diseases. Today we are on parasite. All right. So, your host is Demon Space, and our platform, the name of it is Platform for Education. You see over there. Okay. Later on, I will put my phone number. If you have any problem or any question, you may give me a call. Okay. All right, so let's go right into the program Platform for Education. We say that when people get sick, it got to be, that sickness got to be due to, or it got to be caused. That sickness will be due to something. It will either be due to bacterial infection. It will either be due to parasite infection. It will either be due to virus infection. It will either be due to parasite infection or growth, one of those. So we started with the bacteria, we went to virus, and now we are to parasite today. All right, we got parasite divided into 2 categories, just like we have bacteria divided into 2 categories. All right. Okay. The bacteria are divided to two categories. The two categories we had was what? Gram positive and gram negative. Now we're discussing parasite divided into two categories. Is the two categories are ectopic, ectop. Ecto, we call that ecto ECT or ETC or ETO. ETO parasite. Ectoparasite. That means that's the parasite that live on your skin. They live on your skin. They are there. They only survive. Parasite only survive on your blood. They live on your skin. That's what we call ectoparasite. Ectoparasite. Ectoparasite live on your skin. Endoparasite. ENDO. Endoparasite live inside your skin. Okay, so we're discussing those two. So we started with a parasite that live in the skin. We said endoparasite. Endoparasite live in the skin, live in the body, mainly inside the intestine. All right. One of those we call roundworms. Roundworm we get it, in the egg is in a warm area. You can't. It is very hard to see it in a cold area like where we are right now. More people from the refugee camp would have come here with roundworms. Okay, may have come here with roundworms, and again, you try roundworm from water. You don't wash your hand. We come down to the same thing. If you are not in a unsanitary area, you don't wash your hand, and you shake somebody's hand coming from in the toilet, and you got the green potato green, you buy it, and somebody selling this potato green, and they got that roundworm. The air is on, is passing through the is passing through the feces. The person clean himself and they not wash himself, and you hold the potato green, okay, leave that green and then bring it right to the market. You went to buy the potato green and you think it's clean, you just wash it and you start doing something. It's not the right thing. You can get roundworm from that. And when you got roundworm, the next thing that it does is that it causes around your neighbor. You see that around your neighbor? When you start having pain around your neighbor, you start having pain around your neighbor, you can have roundworm. You can have roundworm when you start having pain. It's not right. That's how roundworm can cause illness, belly pain. Roundworm can cause belly pain. But again, we are in the developed world. We are in the developed nation. Those are not things that happen to people here more often. So you don't see doctor here concentrating on that. The only people you see concentrating on that, when you say, I'm having pain around my neighbor, you know what the doctor here will be thinking about? They will be thinking about appendicitis. Because appendicitis, you have pain around your neighbor, and then the pain comes from the right side of your abdomen, and it travel. You see, where we call my bunny point and all that kind of thing. That all they will be thinking about. They might not be even thinking about, belly pain like that. They will not be thinking about roundworm. Okay? But that will happen. It is more prevalent in Africa. The next one is hookworm. And y'all know hookworm, right? That hookworm, it get into your stomach, it get into your intestine. The hair stick right into the intestine, and it will keep sucking blood. It just keeps sucking blood. This is the type of how do we know? Maybe you may have one or two hookworm, and it will keep sucking blood. And you are not eating enough food that will make more blood cell. So as a result, the little blood you got, the whole worm is there, it's just sucking it, sucking it, sucking it, sucking it. As a result, you are anemic. You see, this is how whole worm cause disease. The whole worm suck your blood so much, and then until you become anemic, until your blood, you got low blood, the heart having hard time pumping this small amount of blood to all part of the body at the same time. Most part of the body may not even be getting the blood properly. If they don't get it, if you have your artery is clogged and your artery is narrow going to your heart, that amount of blood that's supposed to go there is not going there. You will start having chest pain. Okay, now you see, if the amount of blood that's supposed to go to your brain, you are not having it, what you're going to be having? Ischemia. Okay, at the same time, the heart is pumping that little amount of blood, pumping it very hard. The heart will keep doing it until the muscle get big. It fails. You come up with heart failure. You see that? Just from whole worm infection. You have developed heart failure, you have developed ischemia, you have developed heart attack. Whole worm is not a good worms. Okay? When you are mainly when somebody is anemic, especially from that side, from Africa, even here, and the person just anemic all the time, let us check for whole worm. Again, we are in the developed world. The laboratory to check for whole worm, to see, to determine the whole worm, you don't just find that. It's not just easy to find a tropical laboratory technician who can identify these whole worms. You got to find that in the laboratory. You got to diagnose this case from the laboratory standpoint. Okay? The next thing we'll be talking about is pinworm. Pinworm, you know that the child has pinworm. When the child has pinworm, you know how you would know. That child will be scratching the butt. He will be scratching the butt. He will tell you, "Oh, my butt itching," and we call that anal itching. Okay, the anal will be itching. The butt will be itching. Okay, you keep scratching the butt until he can scrape it, and it becomes sore. When it becomes sore, he develops infection. You know, the butt is not a sterile place. So when he starts scratching the butt, when the child starts scratching the butt, be careful. Know that he had developed some kind of worm infection. Okay, and that's pinworm. Okay, then that's how we will diagnose that kind of worm. So we talk about roundworm that will cause pain around your navel. We talk about whole worm that will be sucking your blood in the intestine, in the stomach, and it can cause low blood in the person, and that low blood can lead to heart failure. It can lead to ischemia. It can lead to many different things. Okay, it's not the right thing to do. All right, we'll come back and get you more again. Let's take a little break and we'll come right back.
Why must spoil your liver? Why must spoil your liver? Why must spoil your liver? Change activated. Some kind of way I can get it. Why must spoil your liver? Some kind of way you can do it for me. Why must spoil your liver? Yeah. Some people go sleep and I wake up. I go sleep, I wake up, eh. People hustle, no day, no day. But my hustle bring it so much in. Oh, why must spoil your liver? Why must spoil your liver? Why must spoil you for? See, Papa, your blessing that no more things. Tell it before you can do it again. All kind of thing can creep my skin. When you get my own, I go cock in my leg corner. Cock like a big boy. You know why you make me a big boy. When they make it noise, I don't talk. Take a lepe, walking one side, the children say they bluff you, then they come in, baby, cripple. Blessings on blessings on blessings. You over, you shower your blessings. Don't tell a Jawana. No, some kind of way I can get it. I was spoiled too far. Oh, some kind of way you can do it for me. I was spoiled too far. Yeah. Some people go sleep and I wake up. Then I wake up. I go sleep, I wake up. I wake up. People hustle, no day. But my hustle bringing so much in. I was spoiled. I travel too far, I come back. Go America, I come back. I go Australia, I go Norway, I go Sweden, come back. You can let me go Holland, you can let me go Germany, you can let me go Belgium. I came back and nominate me for MTV. I be music on MTV. My man see me on MTV. Why am I spoiling for? Some kind of way I can get it. Why am I spoiling for? Some kind of way you can do it for me. Papa, why am I spoiling over? Oh, some people go sleep and I wake up. I go sleep, I wake up. Oh, hustle, no day. Then I get it. But my hustle bringing so much in. My hustle. I'm inspired.
All right, good morning. We are back. This is the platform for education. We are on radio, Liberian Radio Television Network. We're discussing parasites, hemoparasite. That's what we are discussing tonight. Hemoparasite. Let me put that there. All right. Hemoparasite is what we're discussing today. All right. We discussed that the parasite, the worm that can cause pain around your neighbor is ascaris, roundworms. The worm that causes you to be anemic, to have low blood, is hookworm. The worm that causes you to have the anus, the butt itching, is pinworm. Now, there's another worm that we call trichinosis. This is the worm that can cause you can have fever, and around your eye will be swelling. All right, around your eye will be swelling. So around your eye will be swelling. Yeah, I'll call you right back.
Okay.
There's the a worm that causes you to be, to have, swelling around your eye, and you have fever, and you got a pink eye and all that. So in this country, when you have those kind of things going on, sometimes you go to the hospital, maybe you got a bacterial infection, they put eye drop in your eye, and you're having fever, they give you Tylenol, but you got worms. Again, we need a tropical doctor. That's why we like to always choose a tropical doctor, both the one that know the Western medicine, and when we say the Western medicine, we're talking about diseases that are in this area, that are in the cold area. Then the diseases that are in the tropical area in Africa. If you find a doctor like that, most of your problem will be solved, because when you come from Africa, they don't check your stool for roundworm infection. Okay, they don't check your stool for roundworm infection. So let me put the roundworm. Let me put those roundworm on so that you just know what we're talking about. Okay, let me put it on so that you know what we're talking about. You might not see me, but you might see the roundworm. Okay. Okay, you see the roundworm? That's the roundworm. Where we see egg, where you see that egg, that roundworm eggs. That's the egg. You see that? That's the egg. That's the egg that is passed through the feces. Now, when you don't wash your hand, that egg, you ingest that egg, it hatch in your body. That's what we're talking about. Okay? So when you get those kind of things, it's not the right thing to do. Okay, so let me show you another picture that you will see when the worm get inside your body, how it behave. Okay, let me show you the other one. Okay, now look at how that is. You see the worm over there. Okay, we got whipworm. Whipworm over there is that's the worm that when you have you go to toilet with blood, you go to toilet with blood with mucus and other things like that. You see, that whipworm, you know what it causes? It causes rectal prolapse, or you will call it hemorrhoid. That's the kind of worm can cause hemorrhoid. You see, Giardia lambia. You see the tapeworm over there in the second circle. That one in the second circle. That's the one. You see, we got 2, 4, 6 circle down there. So let me move those names so that you will see what we're talking about. Okay. Let me move those names so that you will see. Okay. You see that? Let me move this one. Okay. Let me move that. All right. Let me move the topic. So I want you to see. All right. Now you see we got six circles. The first two, we got the first one from the left to right. We got the whipworm. That when you have that whipworm, you go to the toilet with blood and mucus. Okay? And that kind of worm will cause you to have hemorrhoid. The tapeworm is the one that in the second circle. When you have that kind of worm, you know what you will have anemia. Okay? Then the second group, that's the roundworm over there. That's the roundworm that can have you cause your belly pain. You see? Then the next one we call giardiasis. Sometimes you go to the toilet, there's a fat, there's an oil. They're like when you toilet, the toilet is slippery, but you got fat over there. You got fat on the water. Like when you toilet in the camo, you look in the camo, you will look at it like you put oil in the water, you put oil in that camo, it will be sitting on top of the water. When you have giardia infection, that's how the toilet looks. All right. Then you have the hookworm. The one you see, the first one, that was a tapeworm. Then the other one we say hookworm. You see, hookworm and tapeworm, they are two different things. You see, the hookworm, you can get that from feces and other things also. The tapeworm is the one that when you eat uncooked or undercooked pork meat or meat, you can get tapeworm from there. You see, so you got to be careful when you eat roast beef and other things like that. You see, we call coccidia. Coccidia worm is the one that you see over here. They are all transmitted through sanitary area. That's how it is. You see the intestine over there. That's how when the worm is packed in the intestine, it's packed in there. You see, sometimes it become you come with obstruction, you are constipated. You see, that's how they affect, that's how they cause human infection. That's the kind of infection that they cause. So we just want you to see that, all right? We want you to see that. So that's what it cause. I want you to know that this morning, all right? So